Good afternoon, everyone, and thank you for joining us today. My name's Susan Trainer from the Department of Health, Disability and Ageing. Today, we'll be talking about the Residential Care Service List and the Higher Everyday Living Fee. We'll explain what these mean in practical terms for older people and their families, carers and supporters. Our aim today is to help you better understand the services you can expect to receive when moving into an aged care home. Before we begin, I'd like to acknowledge the traditional custodians on the lands on which we are all meeting today. I am joining you from Canberra, on the lands of the Ngunnawal people. I pay my respect to elders past and present, and I extend that respect to all Aboriginal and Torres Strait Islander people with us today. At the end of this webinar, we'll have a Q&A session. We'll answer as many of your questions as we can. You can submit your questions using the Q&A function at any time during the session. If you don't see it straight away, you may need to click on the Q&A icon at the top of your screen. To help the webinar run smoothly, attendees won't be able to turn on their microphone or camera during the session. The webinar slides will also be available on our website, and today's session is being recorded. The recording will be published on our website in the coming days. I'd now like to introduce my colleagues joining us on the panel today. We have Victoria Angel, the Acting Assistant Secretary of the Choice and Transparency Branch. Christian Wynn, the Director of Regulatory Strategy at the Aged Care Quality and Safety Commission. And Jessica Saluco, Director of the Aged Care Quality and Safety Commission's Food, Nutrition and Dining Unit. And on screen now you can see a really quick overview of what we're going to be covering today. I'll start with an overview of the Residential Care Service List. All aged care homes must provide residents with the care, services and equipment required by the Residential Care Service List. These are legal requirements set out in the Aged Care Act 2024 and the Aged Care Rules 2025. It is important to remember that residents do not have to pay extra for these services. They are included as part of the Universal Standard of Care funded by government and the residents' mandatory fees and means-tested fees. The Residential Care Service List has 4 parts. Residential accommodation covers the administration and operation of an aged care home, including the building and the grounds. Residential everyday living covers the things residents need day to day, such as bedding, furniture, meals and toiletries. Residential non-clinical care covers personal, social and emotional support. This includes things like aids and equipment, social activities, and help with personal care and grooming. Finally, residential clinical care covers direct clinical care and services, including nursing care, medication management, allied health, and therapy programs. I'll go into further detail on each of these 4 parts through today's webinar, and we'll provide some examples of how this works in practice. Next, I'll talk about the Higher Everyday Living Fee, or HELF for short. The new health framework was introduced to give older people in residential aged care greater protection, while also giving them choice and control over the extra services they may wish to receive. The health is entirely optional. It can only be charged for services that are a higher standard than or additional to the services aged care homes are already required to provide under the Residential Care Service List. Homes must be able to clearly show any health service is different from the standard services they are required to provide. There are 2 types of health agreements. The first is a standing agreement. This covers services that are agreed in advance and recorded in writing. The second is an ad hoc agreement. An ad hoc agreement occurs when a resident asks for a one-off service that has not been planned or agreed in advance. These agreements may be made verbally, although providers may choose to keep a record of what has been agreed. Each home decides which services it offers under the health and how much it charges for each of those services. This means arrangements may vary from one home to another. The new health arrangements are supported by a range of protections for residents. Residents have a 28-day cooling off period. During this time, they can cancel or change their standing health services without paying any penalties. After the cooling off period, residents can still change or cancel their standing agreement by giving 28 days notice to their home. After the cooling off period though, if the resident chooses to cancel, the home may pass on certain unavoidable costs that continue beyond the 28-day notice period, such as a subscription fee. However, they can only pass on these costs for up to 90 days. The home must also be able to show that these costs were genuinely occurred, and it cannot charge them the amount that has actually been paid in unavoidable costs. If a home can no longer provide a service that's under a health agreement, or can no longer provide it to the standard that has been agreed, the service must be cancelled or changed immediately. If a resident chooses not to pay for health, they must still receive all of the standard services the home is required to provide. The health replaces the previous extra service fee and additional service fee arrangements that were part of the old Aged Care Act. Existing additional service fee or extra service fee arrangements can continue until 31 October this year for residents who had agreed to these fees prior to 1 November 2025. If you are an extra or additional service fee paying resident, your provider should have a conversation with you before 31 October this year. It's important to understand your choices when it comes to moving on to a health. Firstly, check what you currently receive and pay for in your current agreement. You can speak with your provider at any time from now to learn about what health services are available to you in your home and the costs of these. And if you choose to decline a health, you can work with your provider to help you understand what you will receive as part of the standard services under the service list. Individuals can only receive extra services under one arrangement. If changes need to be made to an existing extra or additional services fee agreement between now and 31 October, this will need to be done under a health agreement, and the previous agreement will cease. It is important to point out that it would be unreasonable to charge existing residents a health for services that were previously provided without having to pay an additional or extra service fee. And this is covered in guidance that has been shared with all aged care providers.
Good afternoon, everybody. So now, look, as most of you already know, the new Act included a Statement of Rights. Statement of Rights describes the rights that an older person is entitled to when accessing aged care services. You can see on the right-hand side of this slide that these rights include, broadly speaking, the right to independence, autonomy, empowerment, and freedom of choice, the right to equitable access, the right to quality and safe funded aged care services, the right to respect for privacy and information, the right to person-centred communication and ability to raise issues without reprisal, and the right to access advocates, significant persons, and social connections. Now, each of these rights is explained in more detail in the Statement of Rights, and we would encourage anyone who has not already read through that Statement of Rights to do so. All registered providers must be able to demonstrate to us at the Commission that they understand the rights of older people under the Statement of Rights, and that they have practices in place to ensure they act compatibly with the Statement of Rights. And these are enforceable obligations, and the Commission actively monitors providers' compliance with them. And Tori, I'll hand over to you to talk to the new standards.
Thanks, Christian. So the Australian Government has also introduced strengthened aged care quality standards to help ensure older people receive safe, high-quality aged care that reflects their individual needs and preferences. On the left-hand side of the slide, you can see the Strengthened Quality Standards logo, which shows older people at the centre. These strengthened quality standards set the benchmark for the care people can expect from government-funded aged care homes. They place a stronger focus on key areas such as dementia, diversity, governance, clinical care, and food and nutrition. The strengthened quality standards commenced on 1 November 2025 under the Aged Care Act 2024, and the residential aged care homes must meet all 7 strengthened quality standards. Services funded through the Residential Care Service List must also meet the requirements of these standards in their own right. While the higher everyday living fee or health services may add to or enhance the standard services a home provides, they cannot be used to meet the quality standards. The Aged Care Quality and Safety Commission is responsible for for assessing how aged care homes perform against the quality standards. I'll hand back to Christian to explain the Commission's role.
Thanks, Tori. Right, so many of you are already going to be familiar with how the Commission goes about regulating obligations under the Act and rules. I think a number of providers would have already dealt with this in that context over the last 6 months. Our regulatory purpose and our priorities and our regulatory approach are all laid out in a fair bit of detail in our Regulatory Strategy 25-26, which I would encourage you all to read and be familiar with. And we can send out a link after this webinar for those that might struggle to find it online. In short, though, it's our role to, among other things, make sure that registered providers, responsible persons and aged care workers comply with their obligations under the Act. Now, in addition to those requirements around rights that I was describing previously, this includes making sure that providers are delivering care in accordance with the relevant aged care quality standards, the service descriptions in the aged care service list, and the health requirements that were described earlier. We do this in accordance with our supervision approach, which means that we adjust the intensity of our regulation depending on the risk to older people. So most providers will experience our oversight primarily in the form of engagement. Right? If we become aware of an issue or if we're dealing with a complaint, we'll get in touch with you and we'll work through it to make sure everyone's doing the right thing. However, if we become aware of issues that are presenting risks to older people, or we discover information that suggests a provider is either unwilling or unable to comply, we will ratchet up our oversight and may compel providers to change their behaviour. We've taken both kind of approaches a few times already over the last 6 months in relation to compliance with health requirements, and we'll continue to be keeping an eye out. Again, more information about our regulatory approach is available online. We have a whole section of our website dedicated to explaining the provider supervision approach. And again, I'm happy to send out a link afterwards. Before we continue though, I just want to reiterate what Tori said before. The quality standards and in fact, all obligations under the Act and rules apply to the provision of Commonwealth funded aged care services. Right? That is the services as they are described on the service list. It means that all the funded aged care services you deliver must meet the relevant quality standards and comply with all your other obligations independently of anything else. My colleague Jess will talk about the food, nutrition and dining space later in this presentation, which is where this becomes particularly relevant. Finally, before I hand over back to Susan, I just want to remind everyone that anyone can make a complaint to us if they have any concerns. And you can be as involved in that process as you like. Some people drop us some anonymous feedback and disappear. Others want to stay updated every step of the way. It is entirely up to you. And I will now hand back over to Susan to introduce our case study.
Thanks, Christian. As I mentioned earlier, we're going to use a case study throughout today's webinar. This will give you some practical examples of the care and services you can expect in an aged care home and how the health works with the residential care service list. Today, we'll be following the experiences of Arthur and Elsie. They both live at QualLife Aged Care, but their daily experiences look a little different. Arthur receives the standard care and services that all residents are entitled to. Elsie receives the same standard care and services, but she has also chosen to pay a higher everyday living fee for some additional services that are important to her. Both Arthur and Elsie feel supported and comfortable, but in different ways. Arthur values knowing that his essential care needs are fully met through the standard services. Elsie values having the option to personalise her day with extra services that reflect her lifestyle and preferences. Through Arthur and Elsie's experiences, we'll show how the residential care service list and the higher everyday living fee can work together to support the needs, choices and preferences of older people in residential aged care.
As we move through the webinar, you'll see some of the relevant quality standards highlighted at the top of each slide.
Arthur receives the essential care and services that QualLife Aged Care is required to provide to all residents under the residential care service list. As Arthur has gotten older, he has found it harder to stay mobile. Each day, staff help him with showering, dressing, and moving around. They also make sure he receives good quality meals and snacks. His clinical care needs are also met, which we'll talk about later in this presentation. His room is cleaned and his laundry is done. Arthur does not have to pay anything extra for these services. The standard and quality of his care should not be reduced simply because he chooses not to pay for additional services. Elsie decides she would like some additional services. After moving into the home, she speaks with the manager about which higher everyday living fee services are right for her. Elsie chooses the highest package of additional services. This package includes a telephone in her room, Wi-Fi access, premium meal options, a daily newspaper, and weekly recreational activities outside the home. We'll look at some of these in more detail shortly. Elsie is given a standing health agreement. This clearly explains the cost of each service, how often it will be provided, and how she will be charged. Her agreement is reviewed every year, and her fees can only be increased once a year in line with inflation. If Elsie changes her mind, she has a 28-day cooling off period. Wildlife Aged Care also offers ad hoc health agreements for services that have not been planned or agreed in advance. This means Elsie can choose something extra, such as a barista-made coffee from the on-site cafe, and the cost will be added to her monthly account.
The first category of items included in the residential care service list is accommodation. Quality Standard 4 requires residential aged care homes to provide funded aged care services in a clean, safe, and comfortable environment that supports older people's sense of belonging, interaction, and independence. Aged care homes can demonstrate this in a range of ways, including by making sure the environment is routinely cleaned, well maintained, fit for purpose, and accessible. Quality Standard 2 is also relevant here. It focuses on the organisation's governance, systems, policies, and procedures, and helps ensure the home's operations support the delivery of safe, quality aged care services.
Under the residential care service list, accommodation services cover the aged care home's responsibility to maintain and look after the physical environment. This includes the building and surrounding grounds, as well as fixtures, fittings, and the infrastructure in residents' rooms and shared areas. The aim is to make sure the home is comfortable, safe, and fit for purpose for everyone who lives there. Homes are also responsible for the administrative processes needed to support the day-to-day operation of the aged care home, including the proper management of paperwork. And it's important to note that a higher everyday living fee cannot be charged for any accommodation-related services. Going back now to our case study, that means that both Arthur and Elsie don't pay anything extra for any services related to accommodation. And these are covered by their room price, which they pay as a refundable accommodation or daily accommodation, a refundable accommodation deposit or daily accommodation payment. Everyday living services under the residential care service list are the services people need as part of daily life. This includes things like telecommunication services, bedding, furniture, and toiletries. It also includes meals. Aged care homes are responsible for making sure everyday services are well organised and delivered reliably. They must also have plans in place for emergencies such as bushfires. Homes must ensure that all residents have access to essential utilities, including electricity, running water, heating and cooling to a comfortable temperature. Living areas must be clean, tidy, and well maintained. This includes shared spaces as well as residents' own rooms.
The quality standards also support these requirements. Standard 3 requires homes to make sure older people receive quality aged care services that meet their needs, goals, and preferences and support their quality of life, reablement, and maintenance of function. This is reinforced by Standard 7, which focuses on helping older people maintain their quality of life, build on their skills and strengths, and continue doing the things that matter to them.
Let's return to Arthur and Elsie. Arthur has access to a telephone in the communal living area of the home. He uses it to stay in touch with his family and friends each week, and he does not have to pay anything extra. Elsie asked for a telephone in her room because she prefers to make calls in the privacy of her own space. She also has access to Wi-Fi and a Netflix subscription, so she can stream television shows and movies on her personal device. When Elsie moved into the home, QuiLife Aged Care tested and tagged her tablet to make sure it was safe and met electrical standards. Elsie pays a higher everyday living fee for these additional services. This fee covers the telephone in her room, her call costs, Wi-Fi access, and her Netflix subscription.
Food and drink are fundamental to health, dignity, identity, and quality of life for people living in aged care homes. As part of the quality standards, a dedicated standard on food and nutrition has been introduced. This is Standard 6. This standard requires homes to work in partnership with older people to provide a quality food and drink service. That includes appetising and varied meals and drinks, as well as an enjoyable dining experience. Homes must also understand each person's nutritional needs and regularly assess their current needs, abilities and preferences in relation to eating and drinking. Older people must be supported to eat and drink in a way that meets their needs and preferences, while also supporting social connection, function, and quality of life. The requirement in Standard 6 also reflect the person-centred focus of Standard 1. Standard 1 reflects important concepts about dignity and respect, older person individuality and diversity, independence, choice and control, culturally safe care, and dignity of risk.
Under the residential care service list, homes must provide at least 3 nutritious meals each day, with snacks and drinks always available. Meals must be tailored to a person's medical, cultural, and religious needs. This includes, for example, vegetarian, kosher, or halal meals. If a doctor or dietitian recommends a special diet, it must be provided at no extra cost. Residents may not always receive their exact preferred meal, but aged care homes must be able to show that they are working in partnership with residents on food choices. Providers may offer premium meals and refreshments through a higher everyday living fee if those services are additional to or of a higher standard than what must already be provided under the service list or the quality standards. These premium options must not replace or reduce the standard meals residents are entitled to. This includes the quality, nutritional value, portion size, variety, and availability of standard meals. Any premium meal or refreshment must clearly provide something extra beyond the standard service. Residents who choose not to pay for premium options must still receive meals that fully meet their nutritional and clinical needs.
Access to nutritious food is a fundamental human right, and for older people, food, nutrition, and the dining experience is essential to their health, well-being, and quality of life. If individuals are not provided with food and drinks that meet their nutritional needs and choice about what and how much they eat and drink, or they are charged extra for this, providers are at risk of not meeting their obligations. As Victoria mentioned earlier, the strength and quality standards give focus to food and nutrition through Standard 6, which outlines the requirements of providers delivering residential care. Considering this, an everyday menu for older people should include partnership with older people, different meal options that older people can choose from for breakfast, lunch, and dinner, adequate nutrition provided through varied and acceptable sources, nourishing snacks and drinks whenever people choose, and food and drink that meets people's clinical needs and dietary requirements and supports their personal preferences. As Susan mentioned, premium options through our health must not replace or diminish the culinary or nutritional quality, portion size, variety, or availability of everyday or standard meals. This must be a demonstrable enhancement. In other words, premium meals must demonstrate enhancement beyond the standard meals provided. This is also a good opportunity to also highlight that the Commission has a food, nutrition and dining hotline available for aged care providers, workers and older people receiving government-funded aged care services and their supporters to contact us with any food-related questions, concerns or complaints. When you call the hotline, you will also have the opportunity to speak with a health professional from the Food, Nutrition and Dining Unit for any advice or relevant information on your matter. Therefore, if you have any questions or would like to raise a concern regarding food, nutrition and dining, you are encouraged to call us on 1800 844 044.
Let's return again to Arthur and Elsie. At QuiLife Aged Care, an accredited dietitian helps design meal plans to make sure meals meet residents' individual needs, requirements, and preferences. Staff also check in regularly with residents through a monthly food forum to hear their feedback about the meals. Arthur's doctor has recommended a low sodium diet. The standard meals provided to him are tailored to meet his nutritional needs and preferences, and he does not need to pay anything extra for this. Elsie does not need a specialised diet. However, she has chosen to pay a higher everyday living fee for some additional meal-related services. She can choose from an a la carte menu, has a glass of wine with dinner, and enjoys a special high tea once a month with other residents who have chosen health services. Even though Elsie pays a health, her meals are of the same nutritional quality as Arthur's. Both Arthur and Elsie enjoy meals that are filling, visually appealing, and nutritionally balanced, with important nutrients for older people, such as protein and calcium. Moving on, we'll now talk about non-clinical care services.
The main quality standards that apply here are Standard 1, 3, 4, and 7. Standard 1 is relevant as it reflects important concepts about dignity and respect, older person individuality and diversity, independence, choice and control, culturally safe care, and dignity of risk, all important in fostering a sense of safety, autonomy, inclusion, and quality of life for older people. Standard 3 is about making sure older people receive quality aged care services that meet their needs, goals, and preferences and support their quality of life, reablement, and maintenance of function. Standard 4 is about making sure the equipment used in delivering aged care services is safe and suitable for the needs of older people. And Standard 7 also applies here. It includes requirements relating to the residential community and helps ensure older people receive services that support their quality of life, build on their skills and strengths, and enable them to do the things that matter to them.
This part of the service list covers a wide range of personal, social, and emotional support services. This includes things like help with daily living, such as grooming, hygiene, and dressing. It also includes support with communication needs, including for people who have difficulty hearing, seeing, or speaking. Homes must also provide aids and equipment to support mobility, such as wheelchairs and walking frames. Continence management is also included, so residents receive the continence support products they need. Your home is responsible for coordinating both the non-clinical and clinical services you may need. Non-clinical care includes support for emotional well-being. For example, helping you settle into your new environment, providing ongoing support if you experience loneliness. Recreation and social activities are an important part of well-being and quality of life in aged care. Homes must offer at least one activity each day. This could include things like board games, organised walks, trivia, or cultural celebrations. Sometimes these activities may take place outside the home, and there may be an extra cost for these. Let's go back to Arthur and Elsie and look at how they take part in recreational activities. Each week, Arthur and Elsie join Tuesday afternoon trivia. This is provided at no extra cost by QuiLife Aged Care, along with a range of other regular activities, such as yoga, lawn bowls, casino night, and music classes. The home also offers a weekly activity outside the aged care home. This week, QuiLife Aged Care has arranged a supported excursion to the zoo. Elsie's higher everyday living fee includes the weekly off-site excursion. Arthur chooses to pay for the excursion through an ad hoc health agreement, deciding each week whether he would like to take part in the activity on offer. The fee covers a bus trip to and from the zoo, entry to the zoo, and lunch at the on-site cafe. Residents who do not pay extra for the staff who accompany and support them on the trip. We're about to move on to our final section of the service list. I just want to remind you all that we do have time for a question and answer session at the end of the presentation. So if you haven't already, there's a Q&A box. I think it's other side of the screen, but it's up the top bar. You'll see a Q&A button. Click on that and answer your question, and we'll have about 20 minutes available to answer questions. So now we'll move to the final section of the service list, clinical care.
Residential aged care homes must meet the dedicated quality standard on clinical care, which is Standard 5. This standard is designed to make sure older people receive safe, high-quality clinical care. It covers a range of important areas, including clinical governance, safe and quality use of medicines, comprehensive care, safety of clinical care, cognitive impairment, and palliative and end-of-life care. Under this standard, older people must receive clinical care that is comprehensive, safe, evidence-based, and person-centred, and delivered by appropriately qualified health professionals. Standards 1 and 2 are also relevant here, with Standard 1 focusing on person-centred care and Standard 2 ensures the home's operations support the delivery of safe, quality aged care services.
When you move into an aged care home, a registered nurse will prepare a care and services plan with you. This plan sets out your health needs, goals, and preferences. Your home will review that plan with you regularly and update it whenever your needs change. It's important to note that you cannot be charged an additional fee for the services recommended in your plan and included in the service list. Your clinical care need costs are met in full by government. Your home must provide the allied health services you need. These services must be designed by qualified professionals and tailored to your needs. However, they do not include long-term rehabilitation following a serious illness or injury. Your home must also manage and administer your medications safely. You will still need to pay for the medication themselves, but pharmaceutical benefit schemes, subsidies, and safety net arrangements will continue to apply. When needed, you will also receive nursing care. This may include wound care, support to manage chronic conditions, and palliative care. If you are living with dementia or memory loss, your aged care home must provide tailored support and activities to help you feel safe, engaged, and respected. These supports should be developed with you and your supporters to help maintain your quality of life and respond to your needs. Aged care homes must also make sure you can access general medical services. You may still need to pay for the medical service itself, and Medicare arrangements will continue to apply. If you need to travel outside the home for an appointment, the home must help organise the appointment and any transport. Arthur and Elsie each had a care and services plan developed shortly after moving into QualLife Aged Care. Arthur has diabetes and takes daily medication to help manage his blood sugar levels. Arthur pays for this medication. However, staff at the home help store and administer his medication with his meals. Elsie has long-term arthritis. By choice, she sees the on-site physiotherapist each week. Because this is not included in her care and services plan, she may pay an additional fee for this service. Both Arthur and Elsie also see a GP regularly. Arthur sees a GP who visits the aged care home each week. He does not pay any transport costs, and his consultation is bulk billed. Elsie prefers to see her family GP at a nearby clinic. When needed, QualLife Aged Care helps organise her appointment and arranges transport through a private taxi service. Elsie pays for the taxi, and her GP bills her directly for any gap payment after her Medicare rebate. Before we move to the Q&A part of today's webinar, I'd like to briefly recap Arthur and Elsie's experiences. Arthur receives the essential care and services that QualLife Aged Care is required to provide to all residents under the Residential Care Service Lift. He does not have to pay a health for these services. Importantly, the standard and quality of Arthur's care must not be reduced because he does not choose to pay for additional services. His essential care and services must still meet the quality standards and be delivered in line with the Statement of Rights, which places older people at the centre of the aged care system. At times, Arthur may choose to pay for one-off extra services through an ad hoc higher everyday living fee. For example, he might decide to join an excursion to the zoo or buy a barista-made coffee. These are one-off services that are not regularly provided and have not been planned in advance. Elsie also receives the essential care and services as outlined by the service list. However, she has chosen to pay for some extra services that are of a higher standard through a health. This includes a telephone in her room, Wi-Fi access and streaming services, premium meal options, and weekly recreational activities outside of the home. The higher everyday living fee comes with a range of consumer protections, and Elsie can cancel her health with 28 days notice. Now reached the Q&A part of our session today. So another reminder again, you can see the little Q&A button at the top of the screen. You can click on that, enter your question, and then we'll try to get through as many of the questions as we can today. We do have a few pre-submitted questions that people sent in when they registered for the webinar, and we'll start with a few of those first before launching into the live chat. So the first one of these is for Victoria. Why did the government introduce a new standard on food as part of the strengthened quality standards?
So the Royal Commission recommended this as a priority issue as part of the urgent review of the previous quality standards. This was recommendation 19 by the Royal Commission. The provision of food and drink that meet older people's needs and preferences is a key concept of the strengthened quality standards. The new dedicated quality standard 6 on food and nutrition builds on quality standards 1 and 3 to outline the provider's obligations around food and nutrition, reflects that access to nutritionally adequate food is a fundamental human right, and that food, drink, and the dining experience have a huge impact on an older person's quality of life. The strengthened quality standards, including quality standard 6, were developed following significant co-design with subject matter experts and a comprehensive public consultation process in late 2022.
Thanks, Victoria. I'll pass the second question across to Jess. What is the Commission's expectation of providers in relation to providing meal choice across breakfast, lunch and dinner?
Yeah, thanks, Susan. So in answering this, it is important to first clarify that the service list is the full list of services that can be funded by the Australian government, whereas the aged care quality standards are a set of requirements outlining what quality and safe aged care looks like. So the quality standards make sure older people receive quality care that is safe, aligned with their needs and preferences, and upholds their rights. For Standard 6, this means providing food and drinks that meet the needs and preferences of older people in residential care homes, with registered providers required to partner with older people to provide a quality food, nutrition and dining experience, to assess and meet the nutritional needs and preferences of each older person, to give older people choice about what, when and where they eat and drink, and also to meet the dining experience needs and preferences of older people. So the requirements of the standards therefore complement the service list, whereby the service list prescribes the service providers are funded for, in this case, the provision of at least 3 meals a day, snacks and drinks that meet individuals' nutritional and hydration needs. And the quality standards prescribe the required standard of these meal offerings, such as, among other things, that older people must be given variation and choice about the meals and drinks that they are provided. Therefore, in line with the services list, we expect providers to meet the outcomes of Standard 6 to ensure that they serve quality meals, snacks and drinks that are nutritious, are varied and are of adequate quantity and aligned with the needs and preferences of their residents. Specifically, that providers partner with older people and routinely undertake individual assessments to understand their needs and preferences, and offer a choice in what they are served at breakfast, lunch and dinner to meet food, nutrition and dining needs and preferences each and every day.
Thanks, Jess. The third of our pre-submitted questions is one for me, I think. What resources will the department be providing to consumers to support them to understand the difference between essential services and higher everyday living services? Of course, today's webinar has covered that in quite a bit of detail, and we will publish it online a little later so that you can come back and watch it again if any of it is useful to you to review, or if there is anybody that you know who was unable to join us today. But there are also resources available on the Department of Health, Disability and Ageing's website to support residents in understanding the difference between the standard quality services under the residential care service list and when a higher everyday living fee may be charged. This includes information booklets for residents about both of these two categories, both the residential care service list and the higher everyday living fee, We've also published guidance for providers to help them understand when it may or may not be appropriate to charge a higher everyday living fee. I'll ask the moderator team joining us today to put the links to those documents in the Q&A chat so that you can all find them and click on them. And we will also make sure that we publish those links when we put the webinar recording up live. I think the fourth question is also one for me, and it's a bit of a scenario. Residents, so we talked earlier in this session about when a person was receiving something and not being asked to pay extra for something that went above the standard required by the service list. This is asking about the reverse of that, which is when a resident was receiving additional services under the old arrangement for a fee, and then they continued to receive those under an additional services fee or an extra services fee at a higher standard than required by the Residential Care Service List after the 1st of November 2025 when the new Act started. But in this scenario, in the lead up to 31 October 2026, the resident chooses not to continue to pay for these services under a higher everyday living fee agreement. Is it the department's expectation that the provider continues to provide such services free of cost? So the short answer on this one is no. It's been made clear in the guidance that the expectation is that if a person was receiving something of a higher quality than prescribed under the service list before 1 November 2025 without being asked to pay extra for it, that they cannot have something that they were receiving within their standard offer taken away from them unless they agree to a health. But if they had already agreed to an additional service fee or extra service fee and were aware that they were paying extra for those services, if they choose then to not continue to pay for those services, it is appropriate for the provider to stop delivering those services because they've decided to no longer pay for them. And it is and in those sorts of circumstances, if a person has indicated they wish to not pay a health, then we would encourage providers to start having a conversation with that resident to help them understand what it is that they can expect to stop receiving after the 31st of October this year. I seem to have lost my colleagues on my view here. I would trust that they're all still here and that we're just seeing some resources very quickly on the screen. I think the next question is also one for me, and then hopefully someone has some questions for Christian, Victoria or Jess, and you can stop hearing me for a little bit. Why are Wi-Fi and regular free-to-air TV not covered under the Residential Care Service List? Does this not give a resident the option to stay connected to the community and family? It also allows them to maintain independence so they can continue to do some banking online and shopping and so on. So the service list actually requires that providers ensure you have access to those sorts of communication services, such as the telephone, the internet or Wi-Fi, but it does specify that it is reasonable for the provider to ask you to pay usage charges or device costs. So it is a requirement that you have access to these things, but it is considered fair and appropriate that the costs of these are passed on to the resident rather than those being included in the standard fees that the government has set and those means tested amounts that a resident may be asked to pay. Where the higher everyday living fee comes in on these is things like a dedicated free-to-air TV service in your room or access to sort of that ongoing access to Wi-Fi. So I'm aware that there's been some public conversation from the Minister around TVs, that most of that was focused around that point we've talked about a little earlier about providers not withdrawing services from people when they were not paying for them before 31 October last year. The next question is going to go to Jess. So, is a hot breakfast such as sausages, scrambled eggs, and so on, if it's not clinically required to meet a person's needs, considered a health service?
Yeah, thank you. So the service list doesn't prescribe specific menu items or require things like a hot breakfast or a cooked meal. Instead, focuses on outcomes, making sure that all residents receive enough quality food that is nutritious and varied and aligned with individual needs and preferences. So ultimately, it comes down to how each home designs and delivers its standard menu and demonstrates that it is meeting the requirements of the services list and quality standards for all residents. So whether this includes, different options across the week or daily, that might be hot options at breakfast is something that needs to be considered. And most importantly, that the menu and those breakfast options provided are meeting the nutritional needs and aligning with the preferences for people living within that home.
Thanks, Jess. Another question for me. Can providers advertise or discuss health services and packages with a prospective resident during the admission or pre-entry process? Previously, we were told that providers were not able to do this, but have heard that providers can now do this. So I think this is talking about one of the consumer protections that was added as part of the transition from additional and extra services fees to the higher everyday living fee, which is a requirement that a person cannot be asked to sign a higher everyday living fee agreement until after they've entered care. And that was a protection that was added to the new Act requirements, reflecting the fact that there were instances of providers effectively asking people to agree to pay for additional services fees as a part of securing the room and treating them as not optional. And there were reports that the providers were making people feel like if they didn't agree to pay an additional services fee, they would lose access to the aged care bed that they needed and they wanted to move into. So just to be really clear, it is okay to have a conversation with the provider before you've moved in about the sorts of higher everyday living fee services they offer, the prices that they offer those for, before you have moved in. It's absolutely fair and reasonable that a person might like to know what sort of services they could consider as part of deciding which home they would like to move into. What you can't do is be asked to sign that agreement until after you have moved in. The next one, could you confirm that the cost of staff attending external activities, such as bus outings, cannot be included in the cost of the outing? The answer to that, I'm told, is yes. Provided the providers must offer regular outings into the community, but it's fair and reasonable for a person to be asked to pay the cost of entry tickets, transport, or purchased food and beverages associated with the outings, but not the cost of staff attending those activities. The next question is another one for Jess, another nutrition question. Actually, before we go to that, I might just mention we have about 5 minutes or so left for Q&A. So if you've got any questions that you've been waiting on putting in to see if we get to it in the presentation and you haven't asked them, then now's your chance if you want us to be able to answer it during today's session. If we don't get through all the questions, we will endeavour to put written responses up on our website to go with the webinar recording in the coming days. So Jess, is there a guideline to measure what is a standard meal or portion? For example, how much protein, vegetables a person needs in a meal? A standard meal and portion could be interpreted differently for different people.
Yeah, this is a great question. And in terms of determining this for both your menu and for the individuals that you care for, it's really important to get expert input from chefs, cooks, and accredited practicing dietitians when menu planning to help determine this for you. So this makes sure that the needs of the older people living within the care home are being met, because people like dietitians can review recipes, ingredients, cooking methods, as well as things like serving sizes, and also help providers to understand what frameworks or nutritional standards may apply to them. So in having that engagement and consultation with the dietitian, you can certainly determine this to make sure that you're providing meals that support the needs and preferences of individuals. But also it's really important to consult with the older people you do care for, because they will also provide that input and that feedback in terms of what they need and what they prefer when it comes to a serve size. But nutritionally, certainly the guidance is to engage and consult with the dietitian.
Thanks, Jess. The next one, you're clearly all not sick of hearing from me. That's another one for me here. Please advise how podiatry fits into the residential care service list, and if and when it can be charged under a higher everyday living fee. So podiatry is a type of allied health, which means that whether or not a person can be charged a higher everyday living fee for podiatry is based on what's in that care and services plan we talked about a little earlier. So the care and services plan, when you enter a home, a registered nurse in the home needs to work with you about what particular clinical care needs you have in terms of your nursing needs, your allied health needs. And if it's recommended that you receive podiatry as part of that care and services plan, then you cannot be charged for podiatry at the level and frequency that is described in your care and services plan. If podiatry is either not in your care and services plan, or you want more podiatry than may be recommended under your care and services plan, then it would be appropriate for a provider to ask that you consider paying a higher everyday living fee for that access to that service. All right. I think, just checking, I think we are going to call that our last question for today and end our webinar there. So there we go. If you'd like some more information on some of the topics we've discussed today, there are QR code links on the web on the screen right now. You can scan those now or scan those later. They provide links to the information booklets for both the residential care service list and the higher everyday living fee. They also provide a link directly to the My Aged Care homepage. That's the webpage that you can go to find information about the topics covered today, as well as a range of other information on all of the aged care programs. Please don't worry if you're unable to use these QR codes. Booklets and a copy of these slides are also going to be made available on the department's website. I'd like to, just before we wrap up, thank Jessica, Christian, and Victoria for joining us as panelists today. And then just before you hang up on us, we'd appreciate if you could complete a short survey to help us improve our webinars. The link to the survey either is or will very soon be pinned to the top of the Q&A function, and would also be sent to you in a post-webinar email soon. The survey will take 1 to 2 minutes to answer 4 short questions. This concludes our presentation today. We'll make the recording available as soon as we can. You can also go to the website to find a range of information about other upcoming aged care webinars that we have. Thanks for joining us today.